Hello and welcome to this special broadcast. In the vast expanse of human endeavor, few pursuits are as vital or as complex as a quest for better health. We stand at a crossroads in that quest, where technology has become more than just a tool. It's a catalyst, reshaping how care is processed, delivered and experienced. To chart the way forward, we delve into technology as an enabler in healthcare innovation. The theme of our special panel discussion in the Optum Presents CNBC-TV18 Health X Conversations series, which is a platform dedicated to fostering a more flexible and progressive healthcare ecosystem. Consider the strides we've made. AI algorithms now assist in diagnosing serious ailments. Advanced data analytics allow for more personalized treatment, while digital health has bridged gaps, offering equitable access to care across diverse populations. Yet, challenges persist. Disparities in digital literacy and infrastructure hinder equitable access to healthcare. Innovation in silos can blunt their impact, and evaluating technological interventions requires robust metrics to ensure continuous improvement. Fortunately, we have a panel of distinguished healthcare leaders here to help us understand the opportunities and complexities that exist at the intersection of technology and healthcare. They're here to not just help us understand, but also to innovate and transform. Ladies and gentlemen, please welcome Dr. Amit Kakar, Managing Partner and Head of Asia, Novo Holdings, Harish Gudi, Chief Information Officer, Optum India, and joining us virtually, please welcome Dr. Indu Bhushan, ex-CEO, Ayushman Bharat, Prashant Warier, co-founder and CEO, Qure.ai, Satish Kannan, co-founder and CEO, Medibuddy. Gentlemen, thank you very much for joining us. Amit, let me begin by asking you, when you look at a 2030 horizon, give us a sense of the kind of innovations which you feel will transform the healthcare sector, not just globally, but here in India as well.
Now, look, absolutely, and a very pertinent question. So today, when you talk about healthcare, it's pretty much in silos. You have hospitals, you have diagnostics, you have patient treatment centers, but none of them focus with patient centricity. They all work in their individual ways and try to help the patient. So if I fast forward to 2030, I would see a complete patient-centric tool that's available, and that will be powered by AI and quantum. And AI today, it's already generating about $1 trillion in revenue. And if you look at one area that AI is making a big impact, that's in healthcare. You mentioned about AI's role in diagnostics. You mentioned about AI's role in detecting early diseases and then managing those diseases. So if I look at 2030 as a physician, I see a patient that's actually now benefiting from all these technological innovations we are talking about and really driving towards personalized medicine, which is now still a little bit of a pipe dream as we sit today in 2025.
Right. Harish, if I were to bring you in at this stage, if there were 2 or 3 healthcare innovations that excite you the most and where you feel we should be investing the highest amount of money, what would those be?
Okay, so look, first of all, it's a pleasure to be here. Thank you for the opportunity. And there are many innovations that's going on out there in the industry. And we can talk about value-based care, we can talk about affordability, we can talk about health prediction. But I think the one thing that really excites me is treating the patient or member as a consumer, that entire shift from treating them as members and patients to consumer. So a sea change is happening out there in the industry of giving the experience that people have come to expect. With all the new age platforms that are available in the retail industry, why should not we have the same experience? So how do I put the consumer in the center and surround the consumer with technology to make life much easier, right? How can I connect the dots on all the data that we have and personalize, like you said, not medicine, but also personalize experiences. If, let's say my kid is sick, and I want to go in there, search for care, find a physician, book an appointment, understand what the condition might or might not be. So using technology to be able to do interventions where I can go and say, hey, my kid has a stomach ache, and the system guides you through what plans you have, who's the nearest physician, who can you go to, can I fix an appointment for you? And doing that entire cycle, I think, is going to create wonders.
Right. Let me also get in Dr. Indu Bhushan at this point. Dr. Bhushan, when you speak about the Ayushman Bharat mission, how do you think it laid the foundation of health tech, healthcare innovation in India?
Parikshit, thank you very much for having me here. And let me tell you that Ayushman Bharat Digital Mission is creating the backbone for digital health in the country. And this is going to play the same role in revolutionizing the health sector as UPI has done for the finance sector. You know, it is doing three major things which will help take the digital health to a different level. One, it is creating opportunity for interoperability. And so right now, a lot of innovations are happening all over the country, all over the world. And to make sure that they talk to each other, they're interoperable. So this Ayushman Bharat Digital Mission is going to be creating that kind of a system where they can talk to each other, whether these are patient-centric applications or hospital-centric applications or provider-centric applications, they would all be talking together. Second thing it will do is make the verifiability much more easier. For example, suppose today someone goes with a prescription to a pharmacy. Pharmacy doesn't have any way to assess whether this prescription is correct, whether the doctor which has been mentioned actually exists, or is it a fake prescription. And digital mission will help in terms of not only ensuring that this can be confirmed, but also the doctor that you're talking to through telemedicine or any other places, you can confirm that the doctor actually exists and is what the doctor claims to be.
Right. Thank you for those opening remarks, Dr. Bhushan. Let me also get in Prashant at this stage. Prashant, when you look at artificial intelligence and the use cases in the healthcare sector, what are some of the opportunities that you see on the horizon and certain challenges as we try to leverage those opportunities?
I think I can talk to some of the things that we have been doing at Qure, and we sort of built a technology where you can interpret an X-ray autonomously for detecting TB on that chest X-ray. And if you look at the TB screening protocol as per the WHO, which WHO guidelines came out in 2016, it said that the patient first goes through a symptom screening. So you ask for the symptoms of the patient, then you do an X-ray, and then if the X-ray is positive, you do a sputum test. And the sputum test is expensive, not available everywhere. It's hard to sort of scale. X-rays are easier to scale. But the problem is getting an X-ray read was a challenge. I mean, if you're looking at rural parts of India, you're looking at Africa, Southeast Asia, getting a chest X-ray interpreted, it used to take days, sometimes even weeks. One of our first customers, they used to run mobile man-based screening programs. It used to take them weeks to get an X-ray read. And we were able to make that happen in 30 seconds. So X-ray gets taken, AI is interpreting that X-ray, and within seconds you have a result. So AI can really change the workflow there, and that is how we have changed that workflow for tuberculosis. We have changed workflows for lung cancer. We have changed some workflows for COPD, stroke, heart failure. So again, working on multiple disease areas.
Okay, I'll come back to you, Prashant. But Satish, welcome to the discussion. Now, when we speak about the gaps and differences in digital literacy all across the country, differences in the scale of digital infrastructure, how does one navigate these challenges and making sure that if there are technological innovations that you're offering in the healthcare sector, you're able to deliver it to everyone across the country in the same manner, seamlessly?
No, absolutely. So let's just take a step back to understand the challenges in our country, right? So one, access to good quality doctors is a big challenge because the best doctors, I call them specialist doctors, are pretty much in the top 20 to 25 cities. Good healthcare infrastructure, which is good hospitals, good diagnostic machines, are all again in the top, let's say 50 cities, which essentially means we need to use, first of all, technology to ensure that accessibility is taken care of. Which means anybody, anywhere in India should be able to access a doctor in a big city, get the right advice. Now, can everything happen physically or can everything happen digitally? Which is not the case, right? We need to find a midpoint, and that's what we call as a phygital approach. Some of it can be digitally, done, and at the right point when the doctor has to examine you, or you need to actually go meet the doctor and get an X-ray done or MRI done, then that means you need to be physically present. And we need to make sure that both of these are available digitally as well as physically. So first is to provide the right information. Now that's exactly the question where digital literacy comes in. Now let's look at what are other technologies that have significantly penetrated this market. And we all know we use a lot of social media. It can be a WhatsApp, it can be any of the social media that we use. What's very interesting is there was no user guide to learn all of them, which means these technology platforms were designed such that they're sort of language agnostic and very easy to use from a UI and UX point of view. And that's exactly what, in a way, sort of Medibuddy is also doing. One, make the information available very easily. Two, make sure that you are able to provide them in multiple languages. So in India, we provide around 16 different languages that you can access the services and, of course, the product and talking to a doctor, getting the right information in that, right? The third one is to sort of design our ecosystem and the technology platform for low bandwidth conditions. So it's true, our bandwidth is getting better and better. Devices are also getting better and better. But having said that, from a technology point of view, make sure that all of this is accessible and usable at different price points of devices and different bandwidths that we sort of see.
Please stay tuned as there is more to come on the other side. Welcome back to this panel discussion of Health X Conversations presented by Optum Healthcare in association with CNBC-TV18. As we were speaking about healthcare innovations, the use of AI, quantum computing, and bridging the gap in healthcare delivery all across the country, what are investors also looking for? Amit, I'd like to bring you in at this stage. When you look at healthcare innovations being provided or being proposed by startups in the country or innovators, what is it that you're actually looking for? What's the benchmark that you have when it comes to solutions that will really help the people? What are some of the ethical benchmarks that you keep in mind and the long-term viability of it all?
Sure. So I think very key points that you've raised about all the aspects of where and how we should invest in innovation today. Now, there are a lot of startups out there, a lot of them trying to find solutions to few problems that exist in healthcare. So the first thing we look at it is, what is the addressable market that we are approaching with this new innovation or this new technology? Secondly, will this innovation and technology actually make a difference in patient care or patient management? Or is it, hey, by the way, this is another ultrasound, this is another X-ray system that'll add on to look after the patient, but doesn't bring in any breakthrough in terms of patient care or patient management? Third, we also make sure, I think you heard it from Prashant, you also heard it from Satish, that it follows the right regulatory guidelines. It has gone through the right approval processes, it has gone through the right case studies, and has actually proven benefit in looking at benefits to the patient. So that means you have gone through, if it's a clinical trial process, it has gone through that, it has gone through all the right regulatory checklist and taken care of.
Right. Harish, when we speak about value-based healthcare, what is your approach to that and what role can technology play there and really help us understand value-based care for our viewers right now?
Yeah. So let me simplify value-based care in a short way. If you look at how healthcare generally gets approached today, it's about fee-for-service, which means I'm doing episodic health condition treatment. So there's a challenge. You end up with an episode, you show up at the hospital, you're taken care of. Maybe I give you some tests, I run some diagnostics, I give you some medications, and that's it, you're out. Here is some follow-up that I give you. In this entire system, the focus is on managing the episode versus long-term health outcome and prevention. So value-based care is about shifting left and moving the focus from episodic intervention to a long-term health outcome intervention. That's what value-based care is all about.
Let me also get in Dr. Bhushan at this point. Dr. Indu Bhushan, when you speak about the Ayushman Bharat Health Mission and the learnings from that, if we look at the next 10 to 15 years and the kind of challenges, the kind of needs that we have in the healthcare sector as a country that we have, what would be some of the technological innovations or breakthroughs which you feel we need to do, which you feel the government should also focus on either on its own or in collaboration with private sector to make sure that healthcare reaches the last mile and we get those early solutions, even preventive healthcare to people all across the country?
Well, excellent question. So as you know that we are committed to providing universal health coverage by 2030. And that implies that we need to have affordable, not free, affordable healthcare, quality healthcare, accessible to everyone. And given that we are a vast country and we have a lot of gaps, and as earlier the panelists mentioned, that first thing that digital health can help is extending and providing services, making services more accessible. And that could be done by issues like telemedicine, but also AI. AI can bridge through many of the constraints that we have in terms of human resources, like it was mentioned by Qure.ai initiative. So one thing is that first thing that we can do is improve access. Second thing is to improve quality, because quality access is actually there research to show that not using services is actually better than using bad quality services. So making the system more accountable, ensuring that we are providing quality services, and those services that can be audited and people can be held accountable. And digital health can help in doing that.
Prashant, if we were to ask you about the use of AI, yes, it's important, and every private hospital chain is coming up with their own apps or AI-led solutions to deliver healthcare. But how do we make sure that when we are using AI tools for diagnosis, for example, how do we remove inherent biases from the system and make sure that these models that we have, they work seamlessly across populations, across demographics in the country?
Reality is AI has biases, and AI also learns human biases from the data it is trained on, because data that AI is trained on is produced by humans, and humans have biases in our mind. So that goes to the AI as well, right? And so this is, especially in healthcare, it's a huge challenge. Like I also mentioned earlier, you cannot make mistakes in healthcare. I mean, it could be fatal somewhere. It could be fatal for a patient, right? So in healthcare, I really believe that, like I was mentioning earlier also, any products that are launched need to go through a rigorous evaluation, right? I mean, that is up to the regulatory body, CDSU in India, to ensure that any AI technology has the same rigorous evaluation that is required for a hardware technology. I mean, for example, if you look at a Siemens or a GE, I mean, launching hardware devices in the country, or if you're launching drugs in the country, they go through so much evaluation before they are in the market. I don't know why AI should not have the same amount of rigor in evaluation of AI technology, because the impact could be similar. While it's a software technology, we feel like it's easier and it's probably simpler to deploy and it's easier to manufacture. There is no manufacturing per se, right? And you can deploy very quickly. But I think the rigor that is required for AI should be very high, and products should be evaluated, and regulatory approval should be only given after there is enough evidence to the quality and the safety of the technology.
Satish, when we speak about the example of Medibuddy and the kind of experience it has working with corporates across the country, with hospital chains, how do we make sure? One thing is about coming up with the technological innovation, but then you already have resources available. You've got hospitals, you've got physical healthcare centers all across the country, in remote corners of the country. How do you integrate online technological innovations along with the brick and mortar infrastructure you already have in the country to make sure that you're able to optimize resources and give the right solutions to people?
No, absolutely, Parikshit. I think that's $1 million question that we all are trying to sort of solve. But let me tell you first a few challenges that we face, and then how do we sort of approach them. So first, where does the challenge come from, right? So there's a diverse device ecosystem, right? All of these machines are diverse. They are different companies, different makes. They send out data in different shapes and formats. then most of these softwares are what we call as legacy systems. So they have been there for very, very long time. And there is no reason why they would have to invest further in integrating this back into a system. So that's where also the integration cost. So who will foot the bill is an important question that every hospital or every diagnostic center is also asking. At the same time, there's a lot of questions on data privacy, data security concerns, right? Of course, we need to ensure that every data is important. Medical data is more sensitive because somebody knows that I have so-and-so disease, I have diabetes, I have kidney issue, right? So it's very important that the security and the data privacy is a big factor that is taken into account when you try to bring all of the players in the ecosystem together. And then there's a natural resistance to change. So these are all the challenges that we are saying, right? Multiple devices, data privacy issues that we have, legacy systems. But what's very important is people have started understanding that patient centricity in healthcare is starting to happen. Let's go back 10 years ago, it was sort of doctor-centric or provider-centric. Today, the change is that it is becoming patient-centric. The reason is they have more control, and all of these digital solutions are forcing the doctor or the provider to get on the platform.
All right. Thank you very much to all of you. And thanks to Amit, Harish, and Satish, also Prashant and Dr. Bhushan for joining us on the program. It's been an excellent discussion, and we'll continue to track this story very, very closely because technological innovations in the healthcare sector will be critically watched by everyone.